My name is Kelly Sherman. I use she, her pronouns, and I'm a junior at the School of Public Health, only for a week or so more until finals happen. but um, I just would like to thank everyone for coming and watching our Facebook Live this week. And I would love to introduce our guest, Miss Meyer, and then also Dean Lushniak. If you guys both give us a brief overview and introduce yourselves, that would be amazing.
Right, go ahead, Lauren. You're our guest today.
All right, thank you. The position of honor. So like Kelly said, my name is Lauren Meyer. I'm the program director for career services in the School of Public Health. So I like to say that I'm the face of the career in the School of Public Health. So I bring all of the resources that the University Career Center offers to the School of Public Health, and then I offer that kind of public health perspective on it. So I'm really excited to be here today just to talk about kind of what is available to SPH students and a little bit about what the state of SPH careers looks like right now.
Great, and I'm Boris Lushniak. I'm the Dean of the School of Public Health and just all around public health guy.
Awesome. Thank you guys so much for taking the time out of your day to join us today. And I look forward to our discussion just about internships and the job market right now and how we could best help students and alumni figuring out internships and jobs in the future, because everything is very uncertain right now. But I would like to thank first everyone who's logged into Facebook to watch us and people who jumped on to Instagram last week to watch us too. It's very much appreciative. And also, if you have any questions, just put them in the comments and we'll get to them at the end of our session today. So feel free to comment at any time. But before we dive into this week's episode, I would love to have Dean Lushniak, if you could just frame COVID-19 situation right now and what's been happening in the past week.
Great, and so our usual pattern here at this, the Kelly Sherman Show, as we're calling it now, has been to sort of provide that update of any late breaking news or stuff that's going on from the COVID-19 big picture. So let me start at the big picture. The pandemic continues unabated. There are some good news stories that I'll share, but also some bad news stories in terms of new hotspots developing. Looking at the Johns Hopkins Coronavirus Resource Center, which the students out there, if you've not discovered this site, just do Johns Hopkins and COVID-19. It's a great site in terms of monitoring what's going on worldwide. So the latest information I'm looking off my alternate screen here, almost 4.3 million confirmed cases worldwide, 1.37 million confirmed in the United States, with almost 300,000 deaths worldwide and over 82,000 deaths in the United States. Sort of the big surges that have occurred worldwide has been that all of a sudden whether we're seeing a shift of epicenters or not, we still remain here in North America. The United States remains the epicenter in the world in terms of cases, but now Russia is sort of coming up with a whole lot more numbers and is now sort of creeping up in terms of the number of people affected there. We're also seeing some resurgence, which is of concern back in Wuhan province that had it in essence solved with smaller outbreaks going on out there. I think this was not unexpected, but certainly seeing that the Wuhan has to kind of look at what's going on there and looking at some of their restrictions that they had in the past. And the same thing, some outbreaks occurring in South Korea that in essence had also the problem more or less not fully solved, but in that direction. So I think that gives us a signal that even if we were to solve issues of transmission, at least in the short run, that this is a longer term venture with COVID-19. I would say that the big news stories of the week when it comes to COVID-19 really circulates around the idea of the pediatric population and specifically a new syndrome called pediatric multisystem inflammatory syndrome, which although affecting a small number of pediatric patients, become quite severe and seems to be associated with COVID-19. So this goes against what we were kind of preaching to this point in time of saying that in the pediatric population that there was relatively low risk. And if pediatric patients did have COVID-19, that it was relatively mild or totally asymptomatic. Some subset, and again, I'm stressing it's a really small percentage, but of concern is why are kids having these major issues, including heart issues, They seem to be recuperating from that, but during the time of recuperation, they are critically ill and oftentimes being kept alive by critical care medicine. They bounce back, but that's another part of this, which as I mentioned several times on our show here, is that it brings up the idea that science and public health has to be humble in the midst of all this. The humility really stems from it. Is we thought we're really smart and we thought we can figure all this out, but the virus keeps surprising us with new manifestations. So I would say that's the biggest news there. In Maryland itself, for those of you here in the Maryland area, Maryland's numbers statewide seem to be at least tapering off to some extent. Governor Hogan is already talking about going into the next phase of opening, and we're kind of following the philosophy of what the White House put out as at least on paper. And I'll put in the caveat, the White House seems to put out stuff on paper, and I'm not being political here, I'm just telling the truth, that is either not being implemented by the states or even not encouraged to be implemented by the states. But the White House plan is, in essence, what Maryland is looking at is give me 14 days of a tapering out of COVID, and this could be hospitalizations, this could be death, before you start opening up society. So the good news from Maryland is that we may be at that tapering stage, and Governor Hogan here at the state level may begin sort of this phased approach to reopening our world a little bit. The negative to this, however, it's that where College Park is, Prince George's County, and the county that I'm living in, which is the butts of Prince George's County, Montgomery County, still remain as hotspots within Maryland. And so much like we see different states handling this differently, Governor Hogan has given the ability for counties to handle this differently. So that Garrett County, for example, that's out in western Maryland in the beautiful mountains, may be opening up sooner than we open up here because of the epidemiology of the moment. So that's sort of the state level and the county level. And then at the university level, boy, we're putting in a whole lot of work with multiple committees. And I want to congratulate Kelly for being put on one of those committees. She can tell us about that a little bit later. Students are being incorporated into some of these committee work. And so at the university level, a lot of work being looking at the idea of what are we going to be doing about the fall. And I'm not here to tell you what we're doing because we're not quite there. The University System of Maryland has requested that we put in, and they're kind of coordinating things for the whole system, all the universities and colleges of the University of Maryland system, to begin sort of working together and independently, putting in a plan that's due in the next couple of weeks for us to say, here's our decision-making mode about what the fall is going to bring us. And so, a lot of decisions being made based upon science, data, but also with all the uncertainty that exists there. Finally, at the School of Public Health level, we're completing a semester. We need to have students evaluate the semester, so make sure that there was a survey sent out. We're asking you to be part of the evaluation system, be critical, but also be praiseworthy where we need to hear good news, but also we want to hear how we can better the situation. Also at the School of Public Health level, we do have a contingent of student volunteers who are working with Prince George's County as volunteer contact tracers. We've had some training in that realm. So it's been a good news story in terms of some of the activism of our students. So that's kind of the update on COVID-19 for this last week and some of the highlights and lowlights of the pandemic. So back to you, Kelly.
Thank you so much for just highlighting all of those things on campus and off campus, just what's happening in the world and the state of Maryland, which is really great. Also, it's really cool to see that some SPH Terps and just Terps in general are volunteering to be contact tracers like within Maryland and PG County. And I know that's an opportunity that people can get involved with from many different states too. Like New Jersey just opened up a few things where you could apply. So I was excited about that. But just going into like our segment and talking about like how students can get involved with internships and jobs and stuff in this tumultuous time. Ms. Meyer, could you tell us what resources are available to students during this time from the Career Center?
Yeah, absolutely. So one of the first ones I want to highlight, just so students know, we are still actively taking advising appointments virtually. So I am a Zoom master at this point, and that's how I'm taking all my appointments. So anything from general resume or cover letter review to, virtual interviewing, job search, or if you're thinking, maybe entertaining the idea of grad school, any of those topics I'm available to meet to discuss with you about. You can make those appointments through your Careers for Terps account. So on the home page, there is a request a career advising appointment link. Aside from those appointments, we also have a variety of virtual events. So each of our virtual events that we're holding, we're also recording and then posting in Careers for Terps for students to be able to go back and either re-listen if they attended the first time, or if they weren't able to make it, still being able to get some of that information. So for example, a couple weeks ago, I ran a recruiting during quarantine panel that featured recruiters from the FDA, American Association of Medical Colleges, a couple other organizations that talked about kind of what they're looking for from applicants right now, and kind of what can applicants be doing to really make their resumes like palatable or exciting, and what they're looking for. Some other things that we're looking to do. So there is, you may have seen, ASPPH is holding a virtual career fair on May 15th. So I would definitely encourage students to check that out, even though that's not directly from the Career Center. We're also looking at and promoting other fairs being held by other organizations. And we're also looking at hosting a career fair that we just set the date for June 9th. And so be on the lookout for more details about that as we kind of finalize details. And we're also working on developing career series. These would be short little mini bites on anything from kind of branding yourself, online reaching out to recruiters, and more topics. So definitely be on the lookout. I'm using the SPH Daily Digest very intentionally, so make sure you're reading it. I know it comes out every day and we're all inundated with emails in this virtual time, but just scan it real quickly. The summary at the top. I know I've been talking for a while.
No, this is all good information.
Also, something that I've always encouraged students to use, but is even more valuable during this time, is our interview stream resource, which allows for online interviewing practice. So you're able to go and select the interview questions you want to respond to, and then actually get a recording of yourself responding to them that you can share, with parents, with friends, to ask, what do you think? So you can review it, or you could even book an appointment with me, and then I could go through and talk you through some pointers on, maybe some improvements you could make with the questions. And finally, something I want to talk to is not necessarily a UCC resource, but something that we like to promote, which is the LinkedIn Learning. So it's previously Linda. And in my UCC at SPH biweekly newsletter, we've been featuring a skill of the week. So I think this past week it was working with Excel and kind of mastering those skills. But there are so many other great resources and videos and trainings in the LinkedIn Learning database. Specifically on my Recruiting During Quarantine panel, a lot of the recruiters noted that communication in this time was especially important. And LinkedIn Learning has quite a few trainings on really improving your virtual communication, your written communication. And so I would definitely suggest taking a look at those different videos and spending some time there.
Awesome. And going off of the different skill of the week, that's such a cool idea to have. But what are some tips that students could do during this time, different skills to learn or different things to polish up on, as they might have had internships or jobs be canceled for the summer?
Yeah, absolutely. I understand it is heartbreaking to have worked so hard, have gone through the interview process, and then to have that offer rescinded. I think the number one thing before I even talk about, how to build skills is just to really try to flip your perspective. Instead of thinking of it as, I had this offer taken away, try to take the positive, which is that you were offered that position, right? That is communicating to you that your skills and your knowledge is valued and it is desired, right? So the fact that it was rescinded has nothing to do with that aspect of your resume or the time you've spent developing those skills. One thing you can do as well that I strongly suggest doing with those positions that may have been rescinded is include them on your resume still. Instead of listing the dates that you were employed there, you can just make a note that the offer was rescinded due to the COVID-19 pandemic. And if you have questions about how to do that or what that would look like, please feel free to make an appointment with me. I'd love to walk you through how to include that on the resume. But because that was something that you were offered, that you used your skills and abilities to get. So still highlighting that is still a relevant thing to do. Like I said, LinkedIn Learning is a great thing to be using to brush up on your skills right now. Employers and recruiters are going to be looking to see what students are doing now, right? What are you using this time to do? So whether that's going on LinkedIn, reading articles and writing summaries about them, right? So staying relevant in the professional field and showing that you are up to date with the knowledge that's being put out right now. Another thing that I suggest is really leveraging social media in a professional way. So if you use Twitter, retweeting and subtweeting those organizations that you're looking to work with, engaging with them in that virtual medium. Everyone's paying even more attention to that right now when that's kind of all that we have, right? So definitely suggest those as things that you can be doing right now. I would also say, as much anxiety as we all have, finding time for that kind of self-care and to be gracious with yourself as well. It can be a lot to constantly be thinking about, when am I going to get that job? When am I going to get that interview? One of the old adages, plan your work and work your plan, is another thing that you can be doing right now. So really embed the job search and internship search into your weekly schedule and stick to it, right? So if you're consistently working on something, right, you have, 2 to 3 hours, during the week, maybe 2 to 3 times a week, and sticking to that, you will find those opportunities. You just have to be even more intentional right now and really paying attention and being on top of that search.
Awesome. Are there any I want to bring a light to this conversation, not just thinking about everything that's being canceled right now, but have either of you guys heard of any recent SPH grads or soon to be graduates that are starting their professional journey and where they're going or what offers they have?
Do you mind if I jump in here,
Mm-hmm.
Lushniak? So we're actually starting to get data back right now for all of our graduating seniors. The Career Center just launched our graduation survey. So, definitely encourage you to fill those out. But we've been hearing back, and there are definitely some really great positions, including we have someone working as a grants coordinator with AmeriCorps, someone who has a research assistant position with the Henry M. Jackson Foundation, and quite a few others, none that are, there's not one organization that's hired 3, for example, but we're definitely seeing positions still available and students still getting those full-time positions already lined up post-graduation.
And then
Great. And I think, part of it is that we're also seeing, the federal government as a potential employer, right? Although, various facets of our economy have been hit with this, I know of some success stories, for example, with our Masters of Public Health students who are graduating out, who have at least applied through the government system. Government system has traditionally been very cumbersome in terms of the application process and waiting. But we've seen some successes there with Food and Drug Administration as an example. It tends to be very local, right? This is within 4 or 5 miles of our campus, so it makes it convenient for a lot of our students to look at the FDA. FDA tends to be hiring a lot You know, I'm not sure if you saw even some of the buses that, you know, the shuttle buses have had FDA vet labs before COVID. And again, the government is still functioning, and it rarely gets to a point in a crisis like this where government severely downsizes. Maybe an inefficient hiring process, so go through it. For those of you interested in serving, you know, in the public health sort of world of federal government working, it'll be interesting to see what happens at the state level. I'm looking at the idea that the state will be looking at surges of interest for short-term assignments, contact tracing and all that, and assisting perhaps in some of the epidemiology because of the issue of the financial crisis upon state governments. It'll be interesting to see how long that holds. I'm looking at our graduates looking for all options out there. It'd be nice to land a full-time appointment with somebody, but also look at this idea that in the midst of COVID-19, what you're also trying to do is establish a sense of a portfolio of what you've worked on. And so look at those opportunities. And I know oftentimes people, you know, want to go out there and start making money, sometimes need to be making money, but also volunteer opportunities that in essence buff up your CV, your resume with the idea is this is what I did during the middle of COVID. And maybe it was paid, maybe it was unpaid, you know, a few hours a week even. I'm sure Lauren will agree that that all of a sudden says, oh, during COVID you did this. What did you learn? Becomes a question, right? What did you learn about yourself? What did you learn about public health in action? So I would ask all our graduates to be opportunists, right? You know, it's difficult. The easy approach in the midst of the pandemic saying I'm backing away because of the rest of the world seems to be backing away. No, we're public health people. So be bold in terms of looking at those opportunities, because right now public health needs to be shining, not just for the good of public health, but you as an individual have a pathway to shine as well.
Definitely. And talking about like different pathways and stuff, Dean Lushniak, you talked about the federal government and public health jobs in general. Could you just highlight like different experiences that you've had like before becoming dean, and just like how impactful those were, and also just what you learned from them?
Yeah, I mean, those of you who perhaps know me is, you know, I'm relatively new to the world of academia. I've been dean for 3 years, but prior to that, I spent 28 years in the federal government. So that was kind of my whole career pathway. So most of my adult life was serving at various aspects of public health within the federal realm, and that included, you know, 16 years with the Centers for Disease Control and Prevention, 6 years with the Food and Drug Administration, and then 5 years with the Office of the Surgeon General. You know, government opportunities, as I mentioned, are out there. Sometimes it's a struggle to find them and to find that match. USAjobs.gov, it tends to be the source of information, and people oftentimes, I'm not sure what you've heard, Lauren, from people feedback, but US Jobs, it's gotten better, but it's always been a nightmare in terms of an approach. You know, when you look at public health at the government level, there's so many opportunities at the government level, and even here in the Washington, D.C. area, right? You know, CDC is based out of Atlanta, but has a small office here. But you have the Food and Drug Administration, as I mentioned, has 12,000 plus employees within 10 miles of our campus in various offices. You have the Department of Health and Human Services as a general entity is down in Washington, D.C., but you have the various facets, including the Health Resources and Services Administration, HRSA, which is based in Rockville. You have the Center for Medicare and Medicaid Services, CMS, is based in Baltimore as a sort of an epicenter of their activities. So when you look at even just the Washington, D.C. region, right, there's a lot going on. But I also want people to be looking at the state level positions as well, right? The Department of Health for the state of Maryland usually has job openings out there, oftentimes at the master's level. But we're talking with them more so of them realizing that we're training students who are coming out at the bachelor's level that may be able to fill some underserved areas and take on those jobs. So we're in discussion with them because a lot of jobs are listed for the MPH as the entry level. We're trying to sort of make a headway saying that, you know, after 4 years of being a student at the School of Public Health, you have a lot of capabilities, you know, the jobs need to sort of reassess what their needs are. You know, I got to put it out there, and this is sort of a biggie with me, is that, you know, oftentimes we look at government jobs as if you're overworked and underpaid. Is that true? You know, I spent 28 years, and part of my career path, I kind of felt that, right? But the reality is that right now, especially for recent graduates that are coming out right now, you are looking for an experience level that then is a jumping off point for other experience levels. So yes, pay is important, but experience also at this stage is important. You have to balance what's important to you. So people oftentimes will say is, oh, I'm going to stay away from the county or the state level because they're paying lousy. That may be true, but the experience you garnish from that is oftentimes a jumping off point for other opportunities, or even the idea of advancement within those jobs if you show that you're a good hard worker. Right? That's part of the service component of public health.
And then I guess just going off of like different public health jobs in government and in general, like, are there any specific public health positions that are in higher demand right now, or like students have expressed a lot more interest in right now just because of the COVID-19 pandemic? And I guess I'll ask Lauren first.
Absolutely. I don't know if funny is the right word, but I had just been talking to a colleague right before all of this started about how I'd had, so many students coming in, and really the uptick in interest in epidemiology was something I was very, very aware of and kind of seeing as a trend. And so that has just really continued to ramp up in this time, especially when there's essentially a case study going on in the country right now. And I think for students that are interested in getting into that line of work, right now working as those contact tracers, getting that kind of experience, one on the ground, but also working with epidemiologists or in that field and seeing kind of what those professionals are doing, making those connections is a great thing to be doing right now. Also I think talking back when we were talking about, volunteering, Dean Lushniak brought up the point that we understand how important it is to be making money for some of our students more than others, absolutely. So if that's your number one, finding ways to volunteer, and I know that Dean Lushniak had put out and talked about the Medical Reserve Corps as an opportunity as well, is a great thing for students to be doing who might be looking for opportunities to still get experience in that kind of area. Another thing that I had kind of pop up into my mind as Dean Lushniak was speaking was, students who are a little maybe wary of those government positions, they don't necessarily maybe pay as well. One thing to always look at and remember is that benefits that you might receive are a huge component of pay, in addition just to your base salary. So looking at what positions are offering, and there might be some more leeway in those kinds of benefits outside of the salary in certain positions right now as well. So for students to really remain open to a whole offer package and not just focused on that salary is another important thing to keep in mind during this time in this job search.
Yeah, from my perspective, again, what we know is right now there's a surge of interest and specifically in the world of contact tracing. Now, to be a contact tracer, do you need a master's level? Do you need a bachelor's level? A lot of it is work that is frankly trainable at all sorts of different levels. So don't be put off with this idea that in some sort of jurisdictions, contact tracers are people who have a high school diploma who are being taught up. Doesn't mean that you're not eligible to do that. Doesn't mean that you are overusing, your skill or you're underusing your skill sets. The reality is that it is a response and one that looks good on your resume, right? So whether it's a volunteer or a paid position, look into that. It all depends on funding that's going to be coming from the federal and the state level, because everybody keeps saying that here's the need of contact tracers. We're going to need hundreds of thousands of individuals nationwide to do this. More than likely it will be a temporary scenario, but that's certainly now kind of a big upsurge of interest in terms of those types of opportunities. But once again, on any given day, if you look at the needs of the Department of Health at the University of Maryland, you'll find jobs there that probably will fit your skill set. And once again, it's the risk-taking venture that we're asking people to take. In the private sector, beyond that, it's not that there's zero jobs available. It's just that the private sector is very, is being hit very hard on this. And so, the question is, in the short term, there may be a downsizing of some establishments that have hired public health people. But, my sense is that there's going to be a bounce back as well. So, one needs to keep tabs on those available positions. The idea of training further, right? I mean, I got to tell to our bachelor's level, students is that, you got to sort of consider are you ready for the workplace? The answer is yes, then go forth and do incredible things. But also you think about is further advancement. Are you a candidate for master's level or doctoral level training ultimately? Is that what you want to do? Begin thinking through is how is that going to be timed in light of COVID-19, because that changes you in one direction or the other. But stick with it, right? What you're feeling innately right now is this is who I want to become should not be fully derailed by a pandemic like this. It may be postponed, it may be altered, it may be changed, but we all have aspirations, and especially to our outgoing graduates, who are getting their diploma next week. The reality is keep your dreams alive. Don't sit there and mope saying, oh, it's all over. This pandemic really ruined things. Once again, I got to stress, none of us saw this coming necessarily, right? We didn't know in October that this was going to be happening. By January, we knew something was up. Certainly by late December, people were talking about this, and this has become worse than perhaps we had imagined that it was going to be. I can't take that back. I can't change that as an individual. But certainly as both a dean, as well as a husband and a father, and as a member of this society, doesn't change who I am. And it, in fact, remotivates me to a large extent to make sure that, I'm doing good out there. That's what I'm asking our students to do, is don't get curtailed, right, by all this. This is a bump. This is an unexpected phenomenon. And to a large extent, learn from it and become better as a result. The same thing with goals and aspirations, right? Keep them there, keep them the flame going.
And I think to the point of, don't let your dreams die because of this setback. This is a setback everyone is experiencing, right? So it's not as if you personally are taking this setback, right? And it's setting you behind everyone else, right? We're all going through this, regardless of sector or experience level. So while, maybe that's not the most comforting thing to hear that everyone's, going through a setback, you're not necessarily, out of the game, so to speak. So as Dean Lushniak was saying, keep finding ways to move towards that goal. So keep the goal alive. And like I said earlier, really sticking to that plan and having that plan and direction is going to be what keeps you kind of sane and motivated in these times. And if you're kind of faltering and you're like, I don't know what my plan is, I don't know what the next step looks like, I am here to help you figure that out. So I would love to meet with anyone who is maybe considering next steps, wondering what is out there specifically for them.
Yeah.
And the idea here is resilience too. I think what Lauren touched upon is really important, is don't personalize this, right? This is not a phenomenon at the School of Public Health alone. This is not a phenomenon of College Park alone. It's not a phenomenon of the state of Maryland alone. This is a worldwide global effect. So don't personalize it too much. I mean, feel bad. It's okay to feel bad. It's okay to be out there and exhibit that frustration. I'm going to read you something that I got from a friend of mine today, because it's sort of, and usually I don't necessarily pay attention to these things, but it talks about the resilience of the various generations. And I'm not saying this just to say, well, don't sit there and say, woe be me, this is terrible, but realize that, we've had precedent of things happening and people still doing incredible things. So I'm going to read this because this came out, from a friend of mine this morning. It's probably been circulated. Maybe some of you have seen it on the internet. But, and the specific section of this says, it comes to almost, it's not coming from an academic friend of mine. It's an old friend that I grew up with in the old Ukrainian village in Chicago. But he says, it's being circulated. What does the current student know about any one of these events? And what do you think the person who lived through it all would think of you in your generation? So the question is, it's a generational thing. But now, imagine this. So it's a small perspective. You were born in the year 1900, right? So you're born in 1900. Imagine that, okay? You're 14 years old. What happens? World War I starts, and it ends when you're 18 years old, okay? Then later on in that year, the Spanish flu, right? The pandemic starts, and it runs until you're 20 years old, right? Okay, fine. Now you're 29 years old, and the Great Depression begins with unemployment hitting 25%. The world GDP drops 27%. That runs until you're 33 years old, right? You know, the depression, the stories from that, okay? Now you turn 39, World War II starts, right? You start trying to catch your breath after all this. On your 41st birthday, the United States is pulled into World War II, and that lasts until you're 45. At the age of 50, the Korean War starts. At the age of 55, the Vietnam War begins. At the age of 62, the Cuban Missile Crisis happens. When you turn 75, the Vietnam War finally ends. So what's interesting is that, you know, it puts a little bit into perspective of the resilience of humankind. And I'll submit to you that despite, you know, if we were all born in 1900, despite all that went on, I would say that the individuals born in 1900 still led to having a fruitful life filled with joys and filled with progress and all that. So this is the sense of don't reflect on how, you know, the personalization of it. And again, my theory is not to say don't bitch and moan over this. Right? I shouldn't have said that. Don't moan over this, right? But the reality is that take this and make yourself better as a result of this, right? We did not choose this. We did not ask for this. We, you know, but it happened. How do you be resilient?
That's a really good standpoint. And I think that goes into a lot of our student questions that were submitted right now for this segment. And I think just going with resilience and also just seeing what the university can do to help students. Like one student asked, with the limited number of internships available this summer due to the 2020 pandemic, is the university or department considering modifying curriculum requirements, especially for students aiming to graduate in the fall? And then also that kind of goes with another question submitted talking about someone who's graduating this semester and their long-term goal is to go to medical school, but they have not yet completed all of the prerequisites. And during this pandemic, are there any opportunities that they should get involved with to help boost their chances at getting accepted?
Okay, I'll start off and then let Lauren sort of chime in. In terms of changing academic requirements, right now, we're, you know, again, this is part of our accreditation body's perspective, is that, you know, right now we aren't allowed to make major changes to what is required for the bachelor's level, for the master's level, for the doctoral level requirements. This comes not just from the university itself, but from sort of the higher sources, right? The accrediting bodies that allow us to give these degrees. So if there are going to be discussions, it's really sort of a higher level discussions is what do we change? Right now, we have to look at unique ways of fulfilling those requirements, yes, but the requirements remain. So no one's talking about cutting off the number of hours. Nobody's saying backing off on certain things. So the answer is we still have an obligation to make sure that when you walk away with that piece of paper that says you have a degree, that you have fully attained that degree. So, you know, we're going to have to look at unique ways of how we fulfill certain things and where we're not able to fulfill it because of the ramifications of this pandemic, we're going to have to be honest with the students saying that we may have to defer this, you know, this requirement, you know, you're still going to have to do it, but you may not be able to attain it right now in your timeline. I have to be honest with you. That's the reality. In terms of the sort of the pre-med student looking for unique opportunities, don't forget that an important facet, you know, I look at, you know, and I have two pre-med daughters. So I know not only live this as a dean, counseling students and talking with them in my office about, I'm a physician by training. So I have some insight and I served on faculty at a medical school. So I have that insight. But I'm also living this every day with a daughter who's a junior, a month away from taking her MCATs, and one who's going to medical school in the fall. So you want to talk about living it 24 hours a day in the household with the stressors that come with this? I'm the man, right? That being said, part of the important aspect of this for medical school and any pre-professional program is grades are important, so maintain your grades, right? I can't take that away. Standardized testing, the MCATs, the other, you know, standardized tests, I would love to say they're not important. Not true. Somebody's going to be judging you on how well you do, so you got to prepare for that. But a key component of all this, is going to be the practical side of what you've experienced in that profession. So if you can get yourself involved in the practical side, and that's where your narrative plays an important role, right? So when I look at our pre-professional students right now, there's going to be a little bit of pressure on you because I want you to answer a simple question. What did you do during the great pandemic of COVID-19? What did you do? Because there's going to be a question, right? Somewhere in your pathway are people saying, what did you do, right? And give me a good answer, right? If you said I sat back and watched it from afar, I would say that's a lost opportunity for you, right? If you say that here's part of my narrative and this is what I experienced, I'm going to look at you very differently as a candidate for schools. So some of it is the informal nature that we mentioned multiple times of an experience within all this, right? Volunteerism in the midst of a pandemic, right? It ain't an internship. You aren't getting necessarily credit hours for it. But guess what? If you were in that pre-professional route, I'm going to look at you differently as a candidate if you have a story to tell me, right? And again, part of it is the passive nature. You can't sit back and say, I'm waiting for somebody to ask me to volunteer. This is that opportunity where you put on, get on the internet, look at the opportunities, look at Medical Reserve Corps, be a pest to them, right? Which is, here's my skill set. I haven't heard from you. Where am I going to hear from you? Get involved even in your communities, right? The idea that yesterday I saw this, and again, everybody can't necessarily do this, but think about it. Yesterday on the evening news was examples of students who are, involved in groups that are now finding farmers that are throwing out their products and moving it to needy communities. You're telling me that's not a good news story for a pre-med to saying, this is what I did. I fed hungry people, right? There's multiple organizations out there that are looking for volunteers right now. Begin turning to them, right? Volunteerism, because it's not paid by definition, is not a bad thing because it's not getting paid. And because you're not getting a credit hour, it's not a bad thing, right? Give me a good narrative.
Yeah, thank you for sharing some good news and also just like creative ways to still stay involved and stand out during this pandemic right now. I just wanted to thank you guys so much for answering these questions and just like trying to address different uncertainties that students do have during this time and different resources that the Career Center does have for students and alumni to use now and in the future. Thank you again for taking the time out of your day, and everyone who's watching, thank you for submitting different questions that we could address. There were a couple that we weren't able to address, but hopefully we can do that on next week's segment. And I hope to see you guys soon and stay positive this week. All right.
Thanks, Kelly.
Yeah, of course.
Bye.
Bye.